Machiegni kendo, jopuonjre makwan gi romo 124 e skund thieth mar thieth mar Nairobi Hospital nyosidhi ogudu ayanga. Tend skundno ero nyochiwo ler kawacho ni jopuonjrego oyudo tiegruok kendo nigi lony weche mag thieth mopogore. Koloso e kinde nyasino, japuonj maduong' Margaret Sirima olero ni kwan jopuonjre maromo 7 oyudo tiegruok e thiedho tuoche mag nyarogno, ka komachielo mamoko 18 oyudo tiegruok kendo sani nigi lony e chiwo hocho kod bero. Omedo ni maeri en achiel kuom yore mag chiwo sir ne migawo mar thieth kendo neno ni oganda jo Kenya oyudo thieth makare.
There are jobs not just in Kenya, but also in other countries. But the problem is capitation. There are students who are qualified out there to do the courses offered in this hospital, but unfortunately they are not able to go for the right training when they need it because of sufficiency of funding.
We are going to ensure that all the graduates who graduated today, anybody who wants to work for the hospital, we are going to give them an opportunity to work with us. Of course, we understand how the healthcare human resources, we cannot really tie people to work for us. If they want to explore somewhere, that's okay with us. But anybody who is willing to work for us, once they've trained here, we are going to give them a chance to work here.
We have a very busy renal unit that often dialyzes about 45 patients a day, and therefore we realize there's a need to equip nurses to be able to work in that unit.
So we want that this college eventually graduates into a university where we are giving health sciences training. Nurses, of course, the first opportunity.